when we experience pain, our first instinct, and it's so automatic, is to kind of push away that pain or judge the pain or maybe ruminate around painful thoughts. And the mindfulness is just another way to downregulate and create space for this pain by looking at the pain and the present experience without any sort of judgment. And this can help to increase feelings of acceptance, unhook from painful thoughts, or even reduce fear. And with mindfulness exercises, we go into it without any sort of specific goal, but there is a great side effect that we can feel more relaxed when we use mindfulness. And a great place to kind of start with mindfulness is something like a leaves on a stream or clouds in the sky, mindfulness visualization, where we may take painful thoughts and put them on leaves and allow them to float by on the stream or clouds in the sky. And we just allow it to go by at whatever pace the thought wants to go by, in order just to create some distance and some space and start to change the relationship with the pain. We'll also utilize, like Claire was saying, some more traditional trauma-informed cognitive behavioral therapy, where we may integrate some reframes, but we also want to acknowledge how our unhelpful thoughts or our stuck points may have served a protective purpose at first, and the ways in which they may not be serving us anymore. We can also incorporate some dialectical thinking as a great tool, and this is something where we allow two realities to coexist at the same time. So something along the lines of, I am in pain and I am doing what I can to protect myself or to support myself right now. This helps to validate what we're going through while also broadening the picture, create acceptance, and also can help with reducing suffering. Another great tool that I love to use is self-compassion. And I know self-compassion does not come easily, especially dealing with endo and EDS and the very specific kind of medical traumas that come along with it. When we've experienced that invalidation or dismissal or gaslighting or minimization in medical spaces, a lot of times we may end up experiencing strong feelings of shame, like I'm not deserving of care, I'm not good enough, I'm a burden, because it can actually feel safer to turn inwards. And it serves this really strong protective purpose at first. But over time, we learn different ways in which we can protect ourselves, and we start to recognize that shame may be actually contributing to some suffering. So a great tool to start is actually some mindfulness around the shame, thanking it for trying to protect us, but recognizing there may be other ways in which we could protect ourselves. And I love the simple question of, what would you say to a friend, or what would you say to someone else going through this? And how can you apply this to yourself? Also, I use a lot of just kind of practical tools. Communication skills are a really big one. Definitely boundary setting can be a big one as well. Just understanding what's needed to navigate different pain flares. Some decisional balancing can be really helpful. And also just like more organizational skills as well. When we're navigating so many doctor's appointments and living life in general, it can be really hard to just find that balance. So having those balancing skills plus organization skills can just really be helpful with navigating life with chronic illness.